Hello and welcome to Hopeful Conversations. I'm Vicki Montague and today I'm joined by Rani Bora.
Hi.
And Rani is an inspiration to me, I have to say. I met you, I think it was a few years ago, and I was kind of in awe of you, I have to say, because you're real. Like you're a real person. You to me, it's like, oh my goodness, this person really knows what she's talking about. So to me, this is my understanding, Rani is trained in psychiatry, and you worked in the psychiatric system in the UK in the NHS up until not that long ago. Is that right?
Yeah, until June I had a permanent job, and then I just do a what we call locum, like temporary work, like part-time. So that's what I'm doing.
Yeah. And when I first came across you, I remember just thinking, oh my word, if I ever had any mental health issues, I would want to go and speak to that lady. That's the lady that I would seek out.
Very kind.
Because not only have you got the experience and training of working within within that system, you also have an incredible grounding within the three principles understanding, the inside out understanding, that I also share in my coaching. And that combination to me just fills me with hope, I guess. Hope for a different way of approaching mental health and mental ill health. And I remember Bill Pettit talking a lot about, psychiatrists learn nothing about mental health. They just learn about mental ill health. And they know how to treat ill health, but they don't know anything about health. And that really stopped me in my tracks when I heard him saying that. I'd never really seen that before. So I guess I'd be really, really interested just to hear kind of a bit about how you ended up doing what you're doing. And you've got so many skills as well. I saw recently that you're an EFT like trainer. Is that right? Yeah.
Usually.
And I was like, oh my goodness, this lady has even more levels of amazingness that I didn't know about before. So I'd love just to hear a little bit more about you, because what a great opportunity, and more about your work and what you do and what you offer.
Thank you, Vicky. And before that, can I just say how grateful I am being here, and I also see you just like me. And we all have so many different talents, and sometimes we don't show up, sometimes we just hide, and but the other people start to like say, hey, what that bit of you, it needs to come out, and I'm seeing you out there, and I'm seeing so many aspects of you that I didn't even know about. Including you being an artist, like, oh my goodness, mind art. So I just wanted to acknowledge you for what you do and how you're showing up, and it's just beautiful to follow you on social media. And it's lovely that you call your podcast, about hopeful podcast, because, like you said, having the understanding of the three principles has given me so much hope for me and for people I work with. Something that I never thought was possible, so like many others, we think, oh, there's no cure. The most we can do is like fix temporarily, adjust a few things here and there, adjust medication, increase medication, switch medication, talk therapy, and hopefully something will click. And people do get better, and the people who get better, they don't come to us anymore. But we can't live in this, with the assumption that, oh, it's only the medication and therapy that did something to them, to for them to feel better. We don't look close enough to the person's resilience, the innate resilience, the innate health, and what did they see, what insight did they have in the therapy, what insight did they have when their mind calmed down when they were taking the medication. So those bits are the ones that we are not pointing people to very often. And if we start doing that, I think people will know that, oh, it's not the therapy, or it's not the therapist, it's not the psychiatrist, or it's not my, friends who have helped me heal. It's like they supported me, but actual healing came from within, right? And you also know that. So that for someone to see that is very hopeful.
Yeah, it's amazing, isn't it? That
Yeah.
yeah, and I think that's what I find so hopeful about what you do. I guess because it's the combining of the medication, which it may be required. It may be required in order to allow the mind to settle enough to hear something, to have an insight, to be connected to that knowing, I guess, within. And rather than just kind of medication, there you go, off you go, just sort of plaster over the top. I love the fact that there's the combination of both in what you're offering, like that.
Yeah. So few things like talking about medication, but let's go back to your question, like how, like you said something about how did I, how do I can't even remember what exactly you asked me, Vicky, but something around, is it how I incorporate this or how I came about it? What's the question you have in your mind right now to ask me, given where we are in the conversation?
Yeah, I think I'd love to know more about how you ended up in psychiatry, and then the experiences that you had within that then kind of led you to look
Yeah.
somewhere else, because that's a real curiosity. Like, I think that's unusual. Like, it seems to me that's quite unusual within that arena to look outside of it, to look at the resilience that's within people. I don't know, maybe it's not, maybe I hope it's not. I hope that there are more psychiatrists that are looking in the direction you're looking in, but I'd love to know how that happened for you.
Yeah, I think I can't speak for everyone, but I know that quite a few people are looking in another direction. It might not be in the direction of the principles, but everyone knows that most people don't know that there's something missing. So for me, it was, thank goodness, I would say that I had low confidence, low self-confidence as I was growing up. I said, thank goodness, because if I felt everything was perfect and I'm just amazing, that I might not have looked within, and I might have just bang, 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 just let's achieve something, one thing after another. And so I think I was an insecure child. I was lacking in confidence. It was, it was easy to hide behind the facade of being a doctor, and so that all that was easy. But deep down, I felt quite insecure. And when it came to the point where we all need to look at specialty, like, okay, you have passed out of medical school, which specialty would you go for? For me, it was like something, I've tried all of those: surgery, medicine, cardiology, neurosurgery, and I didn't resonate with them. I felt I was more like someone who could just sit with people. Excuse my dog, I think he's he's going to entertain himself. Um, I just felt like someone who wanted time with my patients, to just listen to them. And so obviously when all the choices came out, psychiatry was a easy option, because, okay, not psychology, because to train as a psychologist, you don't need to go to medical school, and it's not an option for us, but psychiatry was definitely an option. But I, came to psychiatry thinking that's what I was going to do. I was going to heal people, and then soon realized that no, this is not what you're supposed to be doing as a psychiatrist. As psychiatrists, you're supposed to be assessing people, looking at what's wrong, and come up with some, like, okay, this is what's causing them, difficulties or struggles, and come up with a label, treat the label with medication, and then help them with therapy, signpost them to therapy, and so on. And don't get me wrong, as psychiatrists, we are also lucky to get some training in therapy, but knowing that we are not going to be therapists, but we have some training. So despite all that, I still felt something was missing. I really felt that something was missing. And so I was lucky that when I was training to be a junior doctor, I also started looking into the personal development field, because I wanted to fix my insecurity.
Mm-hmm.
I wanted not to feel insecure anymore. I wanted to feel good enough, because I felt I was not good enough. And everything, most people have those, to some extent, right? I'm not good enough kind of story. And so that was the beginning of my journey, feeling, oh, if I can do something to fix myself and that technique works, then I can take the same to my patients. This is why I ended up doing so many different things, including EFT or tapping, and I was an advanced practitioner and also was a trainer until I came across the principles when it felt like it just slipped away. I didn't need to take people back to the past to heal them right now. So it just left me. But more recently, I see that as still a tool, just like medicine. Medicine can be a tool, like you said, sometimes with the correct use. I can also see that I can use the tapping to help people who are really struggling to hear anything, for example, or they are suffering from withdrawal symptoms from trying to come off the medication. So that could be a really useful tool to just give them that, bring them back to the present, where then they also realize, like, gosh, that's not me, that's not who I truly am, and I can have these experiences, but I don't need to get scared of my experiences or try to fix them and try to resist them, because most of the problem, like comes from that. So going back to your question, it's just like, I guess, me evolving, me saying something, and I'm just showing up, just like you are showing up. I'm just showing up with whatever makes sense to me in the moment, and I'm so grateful. I'm so grateful that I'm able to look in this direction, because I know that although there are many doctors and health professionals, they are also like, they know there's something missing. uh, they might not be able to articulate it in a way where they are also able to help the patients look within. I don't know, I'm saying this, but I felt that the three principles understanding, or innate health understanding, give a very good foundation. It's simpler than just saying we are all true love or pure consciousness or something, because when people might say, what the hell does it mean when I'm struggling with my anxiety or depression? So
Yeah.
the innate health understanding really helps people to see something logical first sometimes, and then to use the intellect. But the deeper the more they keep looking, it's not an intellectual exercise anymore. They see something from here.
Yeah, it's so beautiful. Really beautiful. And I'm really curious about the kinds of people you've worked with, I guess. Like, we're talking hopeful conversations, and I think what would be really helpful to kind of bring what you've said into, I don't know, into full color for somebody is to maybe, do you have any kind of examples of people you've worked with who have come to you with you may have diagnosed yourself with a particular mental health disorder, that have then kind of seen this innate health within them and had a transformational experience? I'm just curious, like, whether you have any examples of that.
Yeah, there are countless,
Yeah.
there are countless examples. Even if someone, say someone I've met in the NHS, where I don't get to, speak to them so in detail, like as if I was coaching someone and saying privately. But then even even if I were to ask them to just read a book or go to www.seedbanks.com and explain to them, how they could be listening to them. In a way, Vicky, it's like asking someone to read the book of being, the ultimate coach book. So if the people just read, like you said, it's like, oh, it's a nice the biography of this person, but we know that in order to really get the best out of the book, you need to read the back cover and the front two pages, and then you read about you. I also give some similar instruction to people who want to explore the innate health understanding. So when I definitely point people to the seedbanks.com. I gauge, obviously, if someone seems to very intellectualize and they're like, no, nothing, no, woo-woo for me, I might just give something which is like for example, Bill Pettit. Bill Pettit has a lot of resources, so I might point to that in a very limited time. But otherwise, I would say that, look, you are struggling a lot right now with and you have been on these medications, you have been through all this therapy. And what do you want? What do you really want? And obviously people will say like, I just want to be happy. I just want to like not to overthink. And I said, if that's the case, are you willing to try anything? Most people say, yes, I'm willing to try anything. I would say, well, this is as simple as it gets. Could you do this? Could you go to Seedbankscom and do exactly this? And without trying to breach confidentiality, I can remember a person very recently, very suicidal, um, and for all kinds of reasons you can you can imagine. But the person did not have a very good life, and they always felt suicidal. And only having those brief conversations, along with like doing what I'm supposed to be doing in a health service, just pointing to the direction, is giving the person hope. So they are saying something. Compared to the first time I saw them, the second time they were more radiant. They were like something had shifted, and they still felt that there were some bits they were struggling with, but we were able to have deeper conversations. Now, not everyone is ready for sure. Some people is like, just give me the medication, just give me the therapy, and I'll be fine. So that's there, and we just need to accept that. But what I have found is like my if you call it niche, or who you want to serve, or whatever the language is, I don't get a choice when it comes to like my work in the NHS. Like I serve anyone because maybe it's a free service, and but I think I still feel blessed to have that, because otherwise people won't be able to come and see me.
Yes.
And some people really need that kind of support because they might be on benefits, or they might be really stuck. So I'm so glad that I'm able to do that in NHS, like to give my service for free for that person. But in my private work, I say to people that if you're looking for a diagnosis and you want to find out what's wrong with me, probably I'm not the best psychiatrist to come to, because there are many psychiatrists who would be happy to diagnose you and tell you what's wrong and give you medication. That's not my passion, and that's being very, very honest. Then people say, oh, are you anti-meds? I said, no, I do prescribe meds, but there is a rule. But we need to, there's a term called informed consent. People need to really understand why they are being given a medication in the first place, why they need to take it, what is going to do for them or not do for them, what are the benefits, but most importantly, what are the risks. We don't ask ourselves that, we don't ask the doctors that. And I say this is the main thing. If I were to prescribe something, that's a conversation I will have with people. But ideally, if like people in my private practice, at least, because I am more interested in giving service to those people who are not served, and those are the people who know that they need to come off medication for whatever reason, or they're ready and there's no help out there, and they seem to be really struggling, they can't do it on their own. So those are the people I would love to serve. And I also know that just coming off the medication is not necessarily going to work, because think about it this way, Vicky. If someone went on the medication because they were really struggling with the thinking, with what's happening, and they haven't even sorted that out, they don't even understand, that is still there, like, oh, this happened to me, that happened to me, and this is why I needed to take the medication. So I guess only coming off the medication, most people think I'll come off the medication and then I'll be fine. Well, in a way, that's a big long process in itself, and it can be quite challenging. Can be done, but it can be challenging. But if someone's only aim is to come out of medication without doing the inner work, it's going to be much, much more difficult than if you were going to do both together. So this is what I bring to my private work. If people want to come off medication, now I'm not saying that people need to, and sometimes it might be very, very risky. But if they are in a place where they are considering that, my first conversation with them would be like, how can we make them grounded, and how can we help them so that the soil is fertile, so that for them to like be able to come off that medication, and but also like heal from within at the same time, and they're ready, because that readiness is very, very important.
Yeah, it's really fascinating, that, isn't it? Because it brings to mind for me that whole thing of, we can't change other people, and we can't make other people hear something. We can point them in a direction and we can hold their hand, kind of thing, but we can't make that change. That we can't make somebody experience the world differently. That has to come from a desire from the other person.
Yeah. And Vicky, thank you for mentioning that, because it takes humility for any coach or any psychiatrist or any helping professional to say that. Like, I have been there when I really wanted someone to see, like, oh, you come to me and I've pointed you to Sydney Banks and you don't know what you're missing. And then I needed to go inwards and do my own work, because I'm get into that fixed mode sometimes, like, because I care for you, I really want you to see, can't you see you're suffering? So that again reminds me that, wow, Rani, so what is it that you are unable to see right now about your own thinking? So
Yes.
that puts me back, okay, like, let's pause here, let's take stock.
And it's so easy when you're in a helping profession, whatever you want to call that. The desire obviously is to help people, but it really strikes me over and over again how, I don't know, there was something in what you said about the readiness to do that inner work. It's that readiness can only come from within somebody.
Yeah. Yeah, absolutely. And sometimes we judge people that, oh, they're not ready, look at all that. And Bill Pettit again said something very beautiful. He said, Rani, I don't know a single person who doesn't want to have peace of mind. It's not about like they don't want to, it's just the fear is very overwhelming for them to make any changes. And when we see that, the fear, we have less judgment about the other person, knowing that they are doing the best they can in that moment, where they might say, oh, I want change, and then they go back to their old habits. And I do the same, Vicky. I came across the principle so long ago. I still have moments when I go back to my old pattern, and then I catch myself, and the first thing is to beat myself up, and the second thing is like, wow, it's so easy to beat myself up and judge myself. And so I guess this is a practice, it's an ongoing practice, but we get to see something fundamental that about self-love and self-compassion. No one else can give that to us. Other people can point us in that direction, but ultimately we get to do that in our own time, depending on where we are in our journey of that, like Jack Pransky says, that level of consciousness. Very quickly, let me say that I'm doing a program called Beyond Diagnosis. It's a 12-month transformative program for anyone with a diagnosis. So I get to talk to all these amazing
Wow.
principals, teachers who are coming in, being part of the faculty or the teachers. So I was speaking to Jack Pransky, and he was talking about choice. And he said, Rani, people talk about, oh, it's someone's choice. And he said, I don't think that's like that as simple as that. People make choices depending on the level of consciousness they are on. So in order for them to make a better choice, they need to hear something different. Then they are in a different level of consciousness. From that place, they can make a better choice. But if someone is like low or anxious or like in a lower state of mind, and then we ask them to say, oh, it's a choice, and they don't see other choices around.
No.
So they need to see something different for themselves in order to make a different choice. So I thought that was a beautiful reminder that we are all doing our best given the thinking in any moment.
That's really beautiful. Yeah. And that level of consciousness, that those thoughts will change as well. To know that that's an ever evolving kind of, there's not something that has to be done to get a different choice, but it's something that will naturally happen. That's a really lovely reminder. So are you already doing that program, or is that something that's open for people who might be listening to this now? Or can you tell us a little bit more about
that? Thank you, Vicky. It's starting in March, so there are still some places. If anyone is listening here, they have a diagnosis, or they think they might, a certain diagnosis might apply to them. It's not just physical, mental health, it's also physical health. They can get in touch with myself to know more, or maybe you can put a link to my website.
Yes. Yeah.
It's there. So it's just one of the fundamental lesson for me is that I know that people need to see that they are not their diagnosis, full stop. So my job as a psychiatrist is to say, no matter who gave you any diagnosis, or if you think you fulfill a criteria for a certain diagnosis, you are not that, and let not that not stop you from living your life. So basically, that's what I want people to see and create with me something amazing in their lives.
I love that, because I've always thought that it must be quite a struggle when you've got your psychiatrist sort of hat on, and you're having to, kind of label somebody with a diagnosis. I mean, that is the role, right? But that must be very challenging as well, to know that that isn't who they are, to be able to, how do you kind of overcome that, I guess, that sort of, that disconnect almost.
Yeah, no, I think that's a beautiful question, and I think I just quote Bill all the time. You are not. He doesn't say you are not your diagnosis. He says diagnosis states where you are, not who you are. So I think that's the fundamental. So even if I were to give someone a diagnosis, I would say that to them to remind them. But most people who come to me, they already have some kind of diagnosis anyway in primary care, anxiety and depression, or bipolar, or whatever it is. But the truth is that it becomes an identity, Vicky. And once people know that it is not their true identity, and they can create another level of identity if they want, that's definitely possible for them. Yeah, so this is why I find it so hopeful working in the mental health system now, because I know that again there's just a label given, and then I can have those meaningful conversations with people.
Which is amazing, and it doesn't take very much, does it, to
Yeah.
sort of say to somebody, well, this is the diagnosis that I'm giving you right now in this moment, but that doesn't mean that that's who you are, or that that's going to be what you have in a year's time or 3. That there's that kind of, I think
It's not a lifetime diagnosis.
yeah, I think my misunderstanding about diagnosis has always been, this is what you've got, so that's it. And I think so many people hear that, this is what you have, and so that's your lot the rest of your life. And having come into the 3 principles conversation, I now absolutely see that, like thought, in that moment your body is experiencing this, or your mind is experiencing troubles around that, but that isn't a permanent thing. Nothing can be permanent, right? Like nothing stays the same.
Unlike your true essence, which is the only constant,
Yes.
everything else is dynamic. Everything else comes and goes. All experience comes and goes. All diagnoses even come and go. All treatment and that kind of come and go. And when people really see that and still live life and do meaningful stuff for them, but they know that the only constant is a pure essence, and that's what the principles is pointing to anyway.
Before we finish, can you just tell us a little bit how you see that pure essence? So if somebody's listening to this and they don't know what you're talking about, like, what do you mean I'm not a diagnosis, or what is that constant? Can you point to what that means to you?
One of my patients used a metaphor that I'm going to use just to keep it simple. Um, she was using all kinds of drugs, and she had all sorts of problems, and then we had this conversation, and then she used the I think she said she used the term, sorry, I'm forgetting how the real term, but it's like the she didn't use the truth of who I am or anything like that, by who she used her own beautiful words, Vicky, and she said that thing, the true me can never change. the true me doesn't even need drugs. The true me doesn't need that. And I think she used it like the core who I am, my core. Yeah, she said, my core is not dampened by any of the stuff that happened to me. My core has not been broken by any of the stuff. My core is not affected by da 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 da. And my core is already always intact. And that's the bit I'm talking about. So for her it was like my core, but for someone else it might be like, I don't know, my true self, or whatever metaphor you use is not going to be enough. But knowing that there is a deeper part of you, a truer part of you that's never affected by any of the stuff we experience in life or whatever happens. That's the best I can do at the moment.
Yeah, I love that. Yeah. Yeah, that there's something beyond the busy mind creating, thinking. There's something else, right? There's a quiet that comes before that.
Yeah, yeah.
Yes.
And you know what? We're so busy in our lives, Vicky. The moment you said quiet, I could just experience quiet. That was so beautiful. We go about life thinking that we need to solve our lives, problems and challenges, and we are so busy living life that we are not, that exploring, or even being aware of the quiet that already exists. We are not creating the quiet. It's not about us creating the quiet. It's like falling back and experiencing the quiet which already exists around us, within us. Something that we are not very good at most of the time because of our mind, our ego, which is like constantly pulling us in all kinds of direction. But the moment we do that, we just settle into that space of however you call it, and from that place, your wisdom speaks, and you know that everything is okay as it is right now in this moment.
A beautiful place to end. If that's not hopeful, and I don't know what is.
Yes.
Oh, Rani, thank you so much for your time. It's been so lovely. I could speak to you for a whole day. Yeah, I'd love to.
You're very welcome. Thank you for this opportunity and providing this space for your listeners. I know they get a lot of value of from you just being you, and I'm so lucky to be here today and having this amazing conversation with you. So thank you.
Oh, thank you. And I will put all the details below in the show notes for people to find your website and connect with you if they want to, and find out more about your program, which sounds amazing. So thank you so much for all the work you do. Really appreciate you.
Oh, thank you. Thank you.
Catch up with you soon. Bye bye.